Hi, welcome to Dragonfly Radio. I would like to take this opportunity to introduce Courtney and Nate. They are from the greater Sudbury area and have a story of their own to share. So welcome to Dragonfly Radio.
Thanks.
Thank you.
I'm really thankful that you were able to do this on Thanksgiving weekend. I know it's family time, so that is a little challenge. So thank you so much for taking this time today on a holiday to spend it with us. But I guess if there's anything to be thankful for as parents here in a community that have had a loss, I guess you do have something to be thankful for, right? Yeah. So Courtney, can you just explain to the community and Dragonfly Radio listeners a little bit about what happened in 2015 for yourselves, for both you and your husband?
Yeah. Our firstborn son, we ended up pregnant. We had a relatively uncomplicated pregnancy. I ended up with cholestasis of pregnancy, which is just, it's not extremely uncommon, but I guess I don't think it's really common either. So it's kind of on the edge. And so the plan for our son was to be induced 2 weeks prior to the full term.
Okay.
Yeah. So everything was going good. We were consistent, like non-stress tests, things like that. And then we went in to get induced. And I think it was over the course of 3 days, coming back to the hospital being induced. Everything was fine, like I had said. And they broke my water on Monday night. This would have been the 8th, June 8th of 2015. So Monday night they broke my water. So then I was finally admitted and labored and labor progressed. And then it wasn't until around noon on the 9th that I reached around 9 centimeters. And we were anxiously waiting throughout the rest of the day to see when he was going to be born. But it wasn't until around 5 or so that I actually started pushing, and labor progressed, and it was like I was pushing for 3 hours, so I was extremely tired. And then near the end of it, nurses and doctors were in and out, and finally around 7:34, our son Grayson was born. They did an episiotomy a couple seconds prior to that, but when he came out, he was lifeless. Now, we didn't know anything that had happened. I saw him briefly, and they rushed him right over to next to our bed. And I didn't think too much of it because I had thought, okay, well, babies don't cry the second they come out. And then all of a sudden we started hearing, we heard a code pink. And Nathan was sitting beside, and Nathan was watching everything that was happening. Doctors and nurses came rushing in. They tried to do everything they possibly could. We heard 1 cc of epi, and it was just complete chaos. And after 20 minutes of them trying to keep his heartbeat up, a doctor came over to us and just said, "I'm sorry, we can't keep his heartbeat going." And at that point in time, I think Nathan and I were just in complete shock. I said, okay. I remember laying there, and I remember clearly saying, okay, as if I went to Tim Hortons and, "Can I get a bagel?" "No, sorry, we're out of that kind of bagel." I said, okay. Because I think I was just in shock and I didn't understand what was happening. He was considered born alive. He did have a heartbeat when he was born, but they just couldn't keep it up. So it was just complete disarray.
At any point in time, so you have your little one who's come into this world, and you're expecting as mom and dad to go into the hospital and have a normal birth. There was nothing to tell you there was complications before, right? To my understanding is you just knew that you had to have be induced at a certain date, and you were going to go on.
Yeah.
I had a couple of notes here, and I just wanted to ask a quick question. there was no heartbeat that could be sustained. So in that 20 minutes, were you yourself, Nathan and Courtney, were you in that room in the same room as what they were working on?
Yeah. He was right next to us. It was in the birthing room, and and like he was monitored the entire time, and I think there was some complications with the monitoring tool, and doctors and nurses were in and out, and it was really, I don't know. And
it wasn't your own obstetrician that birthed also, right?
Our own obstetrician, she did the first day of induction, but of course, like all doctors and nurses, they have different shifts. So the labor, like we were getting induced for 3 days pretty much. So it was someone else at that point in time that was in and out.
Okay. Did you ever get any answers as to what happened? Do you know? Like myself, I'm not a grief counselor, right? We're not, Dragonfly Radio is just a way for expression for families to understand and to be able to know they're not alone in the world. Was there ever an answer as to was there never an autopsy or anything done to give you any idea of what happened?
Yeah, so there was an autopsy that was done because we really didn't have a lot of answers.
Okay.
It wasn't, he was right at the edge, ready to come out for almost 3 hours. So we had an autopsy that was done. From basically what the hospital was saying is that he passed away from a blood infection.
Okay.
But in some of our research and in some of the other professionals that we spoke to as well, it just kind of seemed, and I'm not necessarily placing blame.
No, understandable.
Yeah, he was essentially left in the birth canal too long, and ended up being deprived of oxygen.
Okay.
Yeah.
Okay. I'm really sorry for your loss. I'm really sorry that it's an experience that you had to go through. I don't believe any parent should, and it's, I guess things happen for a reason. I don't know myself why things of this nature do happen. Now, you did everything you could to get your answers, and at this point, you've also moved on. Could I ask a very personal question?
Absolutely.
Did you bury your son? Did you?
No. So actually what we decided to do is, after he had passed, we were released from the hospital the next day, and we wanted to get out as quick as possible. And, you're leaving the hospital with a box as opposed to a baby. So that was just completely, I don't even know the words for it. We chose to have a funeral, and we wanted everybody that was comfortable to come and attend. And he was cremated, but he's with us in the house here. Okay.
Mm-hmm. I get that. I probably would do the same. And I think that's, when you'll know when, if at any point, right? Everybody's different.
Yeah.
So if I can just back up 2 seconds. So you leave the hospital, and yeah, I agree. You don't come home with a child that you're supposed to for 9 months, knowing this is what your goals are. Is at any point, did anybody sit down with you and talk about option here in our community? Did anybody give you any indication that we have an organization like our Butterfly Wings or counselors geared to loss of infants and children? Did anybody ever sit down with you before you were discharged to talk about the possible experiences? I couldn't even imagine. I mean, I couldn't even imagine to know what you were going through, both of you, at that point in time. I don't even think I'd want to get that feeling in life. But did anybody give you any options at all?
So we had the day, so after Grayson was born, we were moved into another room, and we were able to spend some time with him. And then the next day, before we were discharged, the social worker came to speak with us. I think it was Wednesday, right? Yeah. And she came and gave us like some information, a couple of things such as, things that you wouldn't assume that you're entitled to, some like 15 weeks because your child had passed away. Some little bit of information like that.
Okay.
As well as a pamphlet on butterfly wings. But at that point in time, you know, I think we were just like staring at her. I don't even know if we really comprehended it all.
Okay.
We just took it.
So if we were to look back and you were to go back to, well, basically 2 years, right? Approximately. Yeah. If you went back 2 years, do you think there's something different as a mom and dad you would have liked to see? If you could turn back, and I mean, obviously bringing home your son would be your first, but on the other side, knowing that this is not an option, would there be something more that you could say we could do here in our community that you would like to see as mom and dads?
Yeah, I mean, I think like when you're going in to deliver a baby and things are completely fine, you never anticipate that you're not coming home with the baby. Thankfully, we had Now I Lay Me Down to Sleep, an organization, I think it's like throughout Canada and the US.
Okay.
Maybe across the world, but they come in and take photographs. So we were happy with that. But small things that some hospitals do, other hospitals don't, but being able to bathe, you know, doing just certain things that you wouldn't anticipate. Like we really never, we didn't even know like how long we could hold him for. We weren't able to put a little outfit on him. We honestly just weren't too sure as to what to do and what we were allowed to do, even though he's our son. We just didn't have that knowledge, and looking back at it, I think it would have been a nice experience to be able to bathe them and to dress them and to maybe like cuddle with them or do things like that, but
it just wasn't.
Yeah.
Okay. So moving forward, you decided not long after you really wanted to bring a child into the world. So how did that experience go for you?
So that was, it was extremely challenging. So, you know, not only were we grieving the loss of Grayson, but we were trying to get pregnant as well. I don't know if we were even mentally and emotionally in a good spot. As like initially when he first passed, but trying to conceive after losing a baby, I think it's a taboo subject that people don't really want to talk about because it's so emotionally draining, and it is a job. It's a you know, all your hopes and dreams left when your son or when your baby passed, and now you're trying so hard to get pregnant again. And it just becomes really challenging, and you're scared every single time, and it's a letdown if you find out you're not pregnant. I mean, I don't know how many times I got pregnancy tests,
yeah,
you know, and sometimes, you know, people won't talk about that because it's really upsetting. But yeah, I bought all kinds of pregnancy tests, and it's a complete letdown every single month. And you know, you're mourning like the loss of your son, and then why can't I get pregnant? And it was a roller coaster of emotions. We ended up finally getting pregnant about a year later. So we actually found out that we were pregnant on the day before Grayson's first birthday.
Okay.
Yeah.
Okay.
So, and then that started a whole new.
Oh, I'm sure it did. I'm sure you're every time you felt a tweak, a nausea or something out of the norm, you must have been thinking the worst.
Absolutely. And I think we were just scared of everything, scared of, like you said, if there's some sort of weird sensation, something. And I think that doesn't go away. That doesn't go away. I found for myself that I would get extremely nervous even before I was pregnant with our son. Scared that something would happen to Nathan, scared that something would happen to a family member, just extremely worried and on edge.
Another question, I'm curious, and I've heard individuals speak differently of it, but yourself, did you ever at any point look for a third party intervention, like a counselor, grief counselor, anybody to help you with that transition? Or did you just use your own support between you and your husband and your wife and family and friends? Or did you look to speak to anybody else?
In getting pregnant?
Well, in the emotional side of it more. So did you talk to a counselor, therapist after the loss and about getting pregnant?
Yeah, so we did. It was probably a couple of weeks after Grayson had passed that I took out the pamphlet that they gave us, the package that they gave us from the hospital, and Butterfly Wings, their number was there. And I'm very prone and go counseling kind of thing. So I didn't hesitate at all to call.
For your mental health.
Yeah, absolutely. And to be able to talk about our story and be able to connect with somebody that might understand how we feel, because it's very isolating.
So obviously your pregnancy on your second one and the delivery went a little differently for you, and you now have Harrison is 8 months. 8 months?
9 at the end of the month, yeah.
So do you think it was just out of control? It was just something that the first time around was just not meant to be for you, but the second was? How do you feel today?
I feel grateful that Harrison's here. But I think we always look at, what would it be like if Grayson was here? Harrison is the younger brother and will always be the younger brother, but Grayson plays a large role in our family and our life. And, we don't shy away from talking about him in the family. Like, Harrison will grow up and knowing about his big brother. But I think that for me, when Harrison first came home, I felt some anger because, and I often said to you that we should know how to do all of these things. Changing a diaper, feeding, doing all of these things that we didn't know how to do because Grayson passed. And if he would have been here, we would have had that experience. So I think that was a tough transition. And, it's as comments that people make throughout, we're 2.5 years, almost 2.5 years since Grayson was born. And there's comments that people make, and you slowly, at times you can feel isolated, and you're slowly left almost like the memory of him. And, we had a lot of social support and a lot of people that would reach out and check in on us all the time. And as the months progressed after Grayson passed, that dimmed too.
Okay. Do you think, Nate, I'm going to ask you a question being a dad.
Yeah.
Do you think society looks at it differently when you lose your son? Do you think that your friends and family don't know what to say, maybe? And being a male version versus a female, females tend to be more open, right? We're mothering, we're compassionate, where men have a tendency, not all, I'm not going to judge, but some men kind of go inside more, right? They don't talk about or express their feelings. Do you find that your buddies, if you went out snowmobiling or you went out quadding or fishing, would talk to you about your loss?
Most of them wouldn't. But I mean, I'm comfortable talking about it. So
Mm-hmm.
I would always bring it up. And then once I would bring it up, then the questions would start coming from whoever I was talking to. But no, I don't really think I've ever had anyone who said, "Oh, hey, how did your son pass away?" type of thing. But like I said, I would always talk about it,
because he's your son, right? And
yeah, exactly.
He's going to be your son, and
Yeah.
I just wondered if you think that men maybe should be a little bit more open to picking up the phone and saying, "Hey, bud, how's it going?
Oh, yeah.
How are you today?" Where I know women do that more, right? Your girlfriends have a tendency on at 10 a.m. in the morning, if they know you're home, they'll pick up the phone and just checking in. How's it going? How's your day? Where I've been with my husband for 35, 36, 37 years, and I could see, yeah, maybe, but that buddy's, it's not the same, right? I don't know how to express that one. do you think that men maybe should have more of that thinking where, you know what, it's okay. It's okay to call me and ask how I'm doing today.
Oh, I think so, 100%. Especially in this day and age now, like there's so much other stuff that goes on in the world. I don't see why not. If it happened to one of my friends, I would be the first one to call. But I mean, because I've had the experience happen to me.
Right.
Now, I mean, I probably would call, had it not have happened, I probably still would have, like if it happened to a close friend or a brother or something, I would still call, but I've always I've always been like that. Like I'm okay. Like I don't get uncomfortable too easily. So for something like that, for some people it's extremely uncomfortable. Some people don't, even to this day, don't even want to, like if I'm talking about them, they oh yeah, okay. But I could tell that I'm making them uncomfortable. So, but I guess it's just,
you're right. It's taboo. And I think, Courtney, you said that earlier. So for some families, individuals, it's taboo, right? It's like talking about palliative care and being prepared. Do you have your wills in place? And again, it's like, if I talk about it, something bad's going to happen. And I think that also.
I think it's just so important. I mean, I'm very fortunate because Nathan has always been open and we're able to communicate. I think we grieve in different ways, but we've been on the path of grieving together. So that has, I think, helped us. But I think there's, it's hard for other dads that might not feel the same way or might not connect the way that Nathan has, or people that want to keep it in, women too. I think it's just really important that people are able to connect with others that have gone through a similar loss, and because no one really knows it, even though no one really knows what you've gone through, and other bereaved parents that were in you don't know what they've gone through, to exactly what they've gone through, but we can empathize and we know a bit because we know the loss of the baby we know what that feels like.
So you have your rainbow baby.
Yes.
And that's a new term for me. I'm just learning what a rainbow baby is myself, because I have a grandson who's one also. And can you just, for those that don't know what a rainbow baby is, and it's not, again, you only need to know what you need to know in life, right? And if you've never known, it's not that I'm ignorant. I didn't know what it was. So could you just explain it a little bit for a few seconds?
Yeah. So it's a rainbow baby is a term sometimes, and it's all a personal preference as to what people that have lost their children, what they want to refer to them as. But in our case, we consider Grayson our angel baby. And that's typically a baby that has passed. And then any baby after the loss is considered a rainbow. So the idea behind that is that after every storm, there's a rainbow. So we have that's nice, actually. That's really nice.
Yeah. So your son is healthy now. Your second born is healthy and doing well. And I'm sure maybe there may be more in the future. Not going to go there. I'll leave you some dignity here. But if you have to, if there's something you want to say that you think another mom or dad might need to know or reach out to, is there any words of wisdom that you have that you may have gained in the last 2 years?
I think you're not alone is a big one. And, reach out to people that have had similar experiences, and it might feel completely isolating. But there are people out there that are willing to talk and willing to connect and willing to share their stories and help any way that they can. And then I think another big thing is that some of the comments that other people make, it's very, very challenging not to take them to heart. But for the most part, I think that people try to say something in a genuine way. We've had people that have made comments like, oh, you're young, you can get pregnant again. God only takes the best, or, it was meant to be, or, he's better where he is. Different comments like that, which very well may be true, but we wanted him. We wanted him here. So I think it's just for bereaved parents to remember that they're not alone, and that there are people out there that will listen and will support. And it's a horrible, horrible journey that you continue to go down every single day. And time doesn't heal all wounds. I don't think that time makes the loss of our son easier. I think it just, the initial pain lessens.
More of an acceptance at that point, but not, he'll always be part of your life.
Yeah.
And your family. One last question. I'm just curious, Nate, if there was, do you believe that maybe we would benefit from having a male organization within our community geared just to men who have had loss of children, may have been stillborn or in utero, even an older child, and, you know, within a tragic accident, a car accident? Do you think our community would benefit from any type of male-oriented only organization? You know?
Yeah, absolutely. Yeah. I mean, I was kind of lucked out because from like what Courtney tells me, because I mean, I was always attending like the grief counseling with Courtney, but she started attending like a group counseling, and just like, unfortunately, I can't be there. I haven't actually been to any just because of the way that fall was during the week, and I'm like out of town working and stuff like that. But just from what she was told me, you know, some of the people are just like thanks for us like having each other, because we're not shy. We can talk about it when no matter what. Whereas, you know, she says, you know, some of the other men or whatever, or women for that matter, they just like, once that happens, they just, both of them are just like, they're gone.
It must be one of the, yeah, you have to have, I don't even know how to word it and stay politically correct myself, but your marriage has to be strong from set go, because I think that could make or break it.
Yeah.
You know, make it or break it. You hear so many relationships over the years that the challenges, you know, maybe finance, like, I mean, and that breaks it. You couldn't even imagine this loss. Yeah.
But for some of the other men or women for that matter, then if they don't have anyone to talk, I mean, like I agree with you, like you said, like with women and stuff like that, how they're more likely to pick up a phone and ask how things are going than a male, I guess you could say. But I think it would definitely help in the community, because I don't think there is really.
No,
there isn't. I mean, I haven't talked to. Well, yeah, I don't really, like, other than some like I said, close friends and this and that, like that's who I've talked to. But it was like, I could tell that sometimes they didn't want to talk about it. So in the right setting with the right, the right people, I guess you could say, where that happened to, I think it would benefit.
Because I did do a little bit of research to see if there was. We have great resources when it came to addiction programs and men-oriented programming, but nothing geared more for dads and loss. And I do believe also that there might be a need. Like I said earlier, it sucks. It's going to happen to someone else, right? At some point in time, there'll be another dad, maybe today, tomorrow, shortly, that him and his wife, or loved one, that thought they were going to have a child, may have been in utero or a stillborn, or, you know, SADS. At some point in time, we all lose, you know, someone, but some of us a little earlier than others in life. But I was just curious what your thoughts were. Who knows? Maybe this will be something you'll think about in the near future. You have my backing if you do.
And I mean, especially with the dads too, because like I remember like when everything happened. I mean, Courtney already explained all that, but like I sat back and I watched it all, right? Whereas like when Courtney mentioned how she said, like when they came over, they said, okay, like there's nothing we can do, and like she just said, okay. And I mean, like I had already I was watching it, so I was already kind of processing it. Whereas, I mean, who knows what, like, I don't, like when they administer drugs and stuff like that, right, throughout the hospital. So, I mean, Courtney was right out of it. So I think it was hard, because I think like when she kind of finally came to, that's when like she kind of started piecing everything together. And I mean, it was already pieced together with me because I was right there the whole time watching, right? So I think sometimes with the people, when they're asking how people are doing, they want to tend to go more towards the woman because she was the one carrying, which is absolutely 100%. There should be either person. There's no better, right? But I think at the time it would have been nice if someone was like came up to me and said like, hey, how are you doing? You know, not like, oh, I'm sorry for your loss. How's Courtney doing?
Yeah, because it is even. Yeah, because Courtney, the women carry the child, but at the end of the day, it's a 50-50 split, right?
Yeah.
It is all the way till their 40s and 50s. It's a 50-50 split. They're your children forever in life.
Yeah.
And so I think you're right that sometimes we forget that, the male role. And I think I do it. We all do it. We forget that. It's the dads play a huge part in the whole process.
Yeah.
Right from set go. Just because they're not carrying the child doesn't mean that the love's any different.
Yeah, absolutely. And you know, even when we were home from the hospital, Nathan taking care of me, you know, we were both grieving and mourning and just a complete mess, but Nathan still taking care of me, making sure that I'm okay and that I'm doing fine, and there's no one there to take care of him, right?
Yeah.
So it was I think it's extremely important for dads to have resources or to be able to connect or feel open enough to do that, you know, whether it's one-on-one or in a group, however that may look.
I think it's something for society, for all of us to think about in the future months and years to come. I want to thank you both for taking your time out on Thanksgiving. I know for you, you have something very thankful to be today. And I'm very happy that, he's doing so well and that you were able to share your story with Dragonfly Radio. And Nate, being male, I'm really, not that I have anything against our female listeners and viewers and participants. It was nice to have a different perspective from a male figure, and what grief, loss, and what to do next is important for everybody, and not just the moms, but the dads also. So thank you for taking that opportunity today to share your story. And everybody listening, again, thank you for listening. And if you have any questions, are you comfortable, Courtney, if they go to you?
Yeah, that would be great. But Nathan or myself, I think we're both very, very comfortable with that. Eh?
Oh yeah.
So I'll share their information via our social media, definitely through Dragonfly Radio, iTunes, Stitchers, and the rest of the formats we work with. So thank you everyone for listening today with Dragonfly Radio. And again, till next time. Thank you.
Thanks.
And did we stop recording?